Backed by popular demand, we're joined by our good friend, Dr. Perry Halkitis, Dean of the Rutgers School of Public Health. Doctor, good to see you.
Good to see you too, Steve.
Taping on the 13th of January. This will be seen later. Let me ask you this. As people see the CDC website, the New Jersey COVID vaccine website, say this program is seen February 13th, March 13th. Where should we be in New Jersey and nationally as it relates to vaccine distribution?
It is my hope that as a country and as a state, by April, May, latest June, we have the majority of people vaccinated in this country and are establishing herd immunity. The ideal situation for us as a nation is to be able to have a summer where finally we're able to return to some sense of normalcy. That's the ideal situation for us.
Doctor, the resistance, particularly in certain communities, you've written, you've talked, you've been, by the way, if people want to check out what's going on every day, check out NJ Spotlight News, also Metro Focus, our public television partners and colleagues. Communities, African-American, Latino communities, the level of resistance, well, there's resistance in a lot of pockets of the population, but in those communities, do you believe the level of resistance will change significantly over the next several months to the vaccine?
So I think you're right to say that there's resistance in every community. And there is. I will point to my cousin, who's a school teacher with a master's degree, who texted me yesterday, should I get the vaccine? And my response was, of course you should get the vaccine. However, Latinx and Black populations have particular concerns because they have a history of facing issues that are imposed upon them by the medical profession. And
getting shafted by the government and lied to, whether you talk about the Tuskegee experiment back in the 1930s, you can check it out if you really want to know how badly the government lied to African Americans in that they were used as guinea pigs, if you will. Help us understand why that historical context matters, Doctor.
Because it creates a distrust, a mistrust of the medical profession, which, by the way, is not gone, right? There are differences in the ways that white physicians and other physicians deal with Black populations as compared to white populations. And there is a level of discrimination that's inherent and a level of implicit bias that's inherent that Black folk and brown folk face on a daily basis in their life, including from their medical providers. And therefore, you see this reaction to the vaccination.
Doctor, let me ask you, this is a series we're doing on COVID vaccine, what you need to know. Okay, we do our role in the government and in the media. What do you believe our role is in the media as it relates to vaccine education awareness? Then I'm going to ask you about the role of high-profile figures, particularly in the minority community. First, about the media. What is the best role, most appropriate role we can play, Doctor?
So I think the media has an important role to play in getting out the science and the facts. I think we have lived for several years now with misinformation about science. I said to a friend earlier, yes, gay people were discriminated against in the 80s for HIV. Scientists have been discriminated against in the last few years in the United States. And then media—
Scientists, I'm sorry for interrupting.
Scientists
have been discriminated against?
Yeah, we've been cast aside, we've been diminished, we've been ridiculed, we've been told that our work doesn't matter. This anti-intellectual, anti-academic movement that's, precipitated in our country has sort of undermined the work that scientists have done. And so mythology and, false beliefs seem to circumvent and, usurp the good science. So media, the news, get the facts out, let people know what to expect, acknowledge the fact that people are afraid, and acknowledge, yes, some people are going to have a reaction, but that's not the norm, right? The trials have shown these vaccines to be safe.
So celebrities, public figures, government officials, people in business, people, sports, et cetera, who happen to be, again, all races, but particularly in the minority community, how effective do you believe that approach is? Part of a larger effort, obviously.
There's many things we can do, but the role of celebrity is huge in our country. Elvis Presley was the role model for the polio vaccine in the late 1950s.
Is that right?
Yes, and Elvis did it on national television, and he became the role model. And so Beyonce, Jay-Z, Taylor Swift, you name it, football players, basketball, like LeBron James is a great role model, for many things. And so I want these folks to go on TV. I want them to do public service announcements, which we don't have enough of these celebrities, the Kardashians. I don't care who it is, but get the word out there that they are doing it and make it normal and safe for people.
I need to ask you about masks, and it's embarrassing a year into this to ask you about masks, but I need to. There's video, and we're actually going to be booking United States Congresswoman Bonnie Watson Coleman, a great friend of ours, who contracted COVID she argues that it was, and again, this is going to be dated, but it's still relevant. She was in a small room with members of Congress when they were hiding on January 6th with the insurrection, the riot that took place. And there was a member of Congress, I believe, I'm not sure from what state, was asking other members of Congress to put a mask on and they refused to. They happen to be Republicans. And Bonnie Watson Coleman and two other members of Congress said they got COVID after that. Members of Congress, we're not going to put a mask on? It's our right still?
It's criminal,
a year
Steve.
In?
Yeah, it's criminal. You know, I've written about this. It's like in the United States, some 40 years into it, we still have HIV criminalization laws on the books, which is absurd. But here we are having people, you know, intentionally spreading COVID, intentionally not wearing masks, and they're not held accountable. This is completely ridiculous. And it is a bad model for behavior to our citizens.
Dr. Perry Halkitis, Dean of the Rutgers School of Public Health. By the way, check him out on NJ Spotlight News on a regular basis. The team is smart enough to know that he's a go-to person in that regard. Perry, thank you so much for joining us. We appreciate it.
Thank you, Steve.
Be safe. I'm Steve Adubato. That's Perry. We'll be right back.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by RWJ Barnabas Health, the Healthcare Foundation of New Jersey, New Jersey Sharing Network, the Robert Wood Johnson Foundation, Johnson & Johnson, the Northward Center, NJM Insurance Group, MD Advantage Insurance Company, and by Fedway Associates, Inc. Promotional support provided by ROINJ and by New Jersey Monthly.
NJM Insurance Company has been serving New Jersey policyholders for more than 100 years. But just who are NJM's policyholders? They're the men and women who teach our children, the public sector employees who maintain our infrastructure, the workers who craft our manufactured goods, and New Jersey's next generation of leaders, the people who make our state a great place to call home. NJM, we've got New Jersey covered.